Hello everyone, myself Dr. Neetu Modgil. I'm ENT consultant working in Hyderabad, KIMS Secunderabad. So today we would like to touch one important topic, that is nasal blockage and the procedures we do to deal with the nasal blockage. Nasal blockage can happen in any age. There is no age bar for it. Even a baby who is 1 year old till 80 years of old, at any age the patient can start suffering with the nasal blockage. Means they may stop breathing from the nose, like there is a blockage in the nose. The blockage in the nose can be like for few months or few days in a year, or it can be like for the whole year they are suffering with the same problem, that they have to breathe from mouth. Now many patients think that they have to breathe, they have to take the air inside, then why not from the mouth, why from the nose? So they keep on dealing and living with the nasal blockage, but they do not understand the major issues of health which it can create with time. Now let us understand what is the function of the nose. One is the smell, and second is to take the air inside. Why nose? Why not from the mouth? Because nose is having small hairs inside. It acts as a filter for the air which we breathe inside. So the air which goes inside the lungs is filtered by the nose. It decreases or increases the temperature of the air which goes from the nose, which is comfortable for our lungs. This is second function. And third function is it gives humidity. It has a mucus secreting gland. So the dry air, if we are breathing, it will make it little humid, which is comfortable for our lungs. So a very good amount of healthy, filtered and a good humidity air goes inside the lungs, which is very important for the exchange of oxygen inside the lungs. Now for example, patient is not able to have the smell from the nose, patient is not able to breathe from the nose. Either it is 2 to 3 months in a year, or it is 6 months in a year, or it is for the whole year. If patient is not able to breathe, what will be the impact on the body? So the air which is going filtered, the patient will be breathing from the mouth, this air will not be filtered. The temperature of the air will not be controlled, it will be dry air. So the impact of this type of air on the lungs with time, maybe a few months or maybe a year later, patients are more prone to lung diseases. They will suffer with any lung ailment, either it is COVID or it is asthma, any problem in the lungs, even pneumonia, they will suffer faster because their lungs are not healthy. Second important point, patients are not able to breathe from the nose, they cannot smell also. So once they are not smelling, it will impact the flavors or taste of the food they are eating. So what will it do? The patients will eat more sugar, will eat more spicy food, will eat more salt in the food to get the taste, and all these things will impact the health. And the mouth will keep on getting dry every time they breathe from mouth, and the saliva will dry up. These patients are more prone to sore throat, and even it impacts the health and good looks of the teeth. So this is how nasal blockage can impact your health. Now coming to the procedure part of how we treat the nasal blockage. There are many reasons the patient having a nasal blockage, can be many reasons. For example, in pediatric age group, usually they have adenoids and they have tonsils also along with that, due to which they are not able to breathe from the nose, because adenoids are the part of the nose which is just behind the nose. So it will block the air going inside. So in that case we do adenoidectomy. And in cases of patients where the nasal septum or the central bone of the nose is deviated to certain extent that it is blocking the nose, we do septoplasty. Septoplasty is the correction of the nasal bone inside. And then there are some masses inside the nose, we call them turbinates. So turbinates also enlarge to certain level that it can block the nose completely, 90% also. So in these cases we remove the turbinates partially. And some patients, they may have polyps, some tumor or something inside the nose. So we have to go ahead with the endoscopic sinus surgery. Now they are beautiful procedures. Why? Because they are just a day, a patient has to be there with us for a day. Some patients, they are good enough, they can go in the evening also, like daycare procedure we call it. Some patients, they feel more sick, next day they can go back home. But the procedure itself is hardly not more than 1 hour, or sometimes very rarely it can go to 1 hour 15 minutes. And mostly procedures we do in general anesthesia, because patients are really scared of syringes and the procedures these days. But the patients who are cooperative enough, brave enough, we can definitely do it in the local anesthesia. So the only blockage in the mind is that I can live with the mouth breathing, but I will not enter the operation theatre. That is a mistake we are doing. That is where we are not using our new technologies in science. We have to use it because nowadays the surgeries are not like that you will bleed so much or you will be like not able to do your day-to-day activity for like 5, 6, 7 days. Nothing like that. Nowadays the technologies are really good. There will not be any scar mark outside. They are all endoscopic surgeries. We have good equipped operation theatre with cobblator, with laser, with all the instruments we need for debriders, we need for the nasal surgeries to be done in certain way that we will not damage the important mucosa inside the nose, but we will only remove the diseased or deviated part of the nose. So for the nasal blockage, there are many procedures depending on what you are suffering for. You are I just request to the population or the public that do not sit at home breathing from the mouth. Please come out from the comfort zone. We are here to help you. It is just a day procedure and you will be having a lifetime change. Thank you so much.